and 1. All right, so today we're going to do chapter 5. I'm going to share my screen. And chapter 5 is the integumentary system. So I'm going to make this a little bit bigger, and I'm not going to do it as a slideshow. So the integumentary system, that is the skin. So what do we have? We have the epidermis, top layer, the dermis, which is the tissue directly underneath, and then you have some accessory organs. Under your skin, you have glands. Sebaceous glands are your oil glands, and sudoriferous glands are your sweat glands. And then you have hair and you have nails, right? So why do we have skin? Skin serves so many purposes, more than you even think about. It is the first line of defense against infection. So because it covers the body and protects us from pathogens, doesn't let things in. It produces secretions from the sweat glands and the oil glands that actually can protect us from certain things. We have nerve endings in our skin that can help protect us from things that are too hot or too cold, but also other sensations like pressure and touch. The skin regulates our body temperature. It synthesizes vitamin D. 15 minutes of sun 3 times a week, and you'll get enough vitamin D produced in your skin to absorb all the calcium that you need. And it gives color to the skin because of melanocytes that are in the basal layer of the skin. So that's how we get our skin tone. Right? Oops. And so we're looking at the combining forms of these words. So we'll do this at the end. Let's get on with this. Okay. So now we're looking at things that can go wrong with the skin. Skin cancer. There are actually 3 kinds of skin cancer. So here we start off with basal cell carcinoma. That's actually the most common type. It starts in the basal cell layer of the epidermis. This is actually, not that any cancer is good, but if you're going to get one, this is a very slow growing cancer and easily treatable. Usually looks the same color as your skin. If it goes on and is there for a while, it can start to turn brown, but usually is the same color as your skin. Very slow growing. It is destructive, but it doesn't metastasize. And in order for it to be invasive, it takes a long time. And I hate to say it, but it's usually blonde or very fair-skinned individuals. And also know that having had a sunburn with blistering at any point increases the risk for basal cell carcinoma. So signs and symptoms. Usually you'll see a lesion or a tumor, right, on the parts of the skin that are exposed to the sun. For older men, generally you'll see it on the head. They don't wear a hat, right, or on the face. They can also occur in other parts of the body, but not as commonly. They can initially look like white or waxy, like a little bump. Sometimes they have little blood vessels in them. Sometimes they can bleed or get kind of a crust over them, or they can have like a little crater or a depression in the center of them. And the treatment, well, usually they will, if you go to a dermatologist, the skin doctor, they want to get the lesion off. So they can do electrodesiccation or curettage of it. So now they're doing laser. So this is even a little outdated. That's the most common way that we treat these carcinomas. We just remove it, right? But again, depends on how long it's been there, what's the size of it, the shape of it, where is it, and has it had the opportunity to become invasive, or is it localized? In situ is what that's called. If it has become invasive, then it's a little more complicated. Sometimes chemotherapeutic drugs, right? Sometimes radiation. So there can be other treatments. Then we have something called an abscess. Abscesses are fun. This picture shows an abscess at a furuncle, which is a fun word. It's a hair follicle that fills up with purulent exudate or pus. Usually it's a staph infection. So the word abscess just means a localized collection of pus at the site of an infection, okay? And usually, not always, but it's on hairy parts of the body, right? So that, like with this guy, the nape of the neck. And they're very painful. And usually the pain isn't relieved until they are lanced. And lancing means that we have to puncture it in some way to drain out the purulent exudate that's inside. So a furuncle, again, that's a fun word, which is another name for a boil, usually is an abscess in a hair follicle and right around that subcutaneous tissue. Then a carbuncle is a few of those furuncles that develop in adjoining hair follicles. So in other words, there's a bunch of them that kind of all conjoin together with different drainage sinuses that kind of all meet, right? So that's even a little more painful and difficult to deal with. Signs and symptoms. It's going to be swollen, tender, usually red, right? Sometimes it will enlarge and open on its own. Sometimes, like I said, it would have to be lanced or opened surgically. And you're going to see some good smelling and good looking pus or necrotic material. Necrotic means dead, like dead cells oozing out of it. Usually smells great. Once it is treated, the patient will usually have some erythema, redness, and edema, swelling, sometimes for a couple of days or in a couple of weeks. If it's really significant, they can have a mild fever. Typically, a fever is an indicator of a systemic infection as opposed to a localized infection. But some people develop fevers. And treatment, cleansing it, hot compresses. A hot compress, sometimes it will open on its own, right, and drain. Topical antibiotics, and then I&D, incision and drainage, like I said, surgically to get the gunk out. Then we have the heartbreak of psoriasis. Psoriasis is a chronic, non-infectious, inflammatory skin disease. And you see it's very common in people who have allergies and or asthma also, by the way. And there are some theories with regard to nervousness being kind of a mitigating factor. But what it looks like are these circumscribed or round looking red patches, and they're covered with this scaly, thick, dry, almost silvery looking skin, right? Very dry, very flaky. In psoriatic skin cells, those epidermal cells proliferate at an incredibly fast rate. So 6 to 9 times faster than a normal skin cell. And usually family history. So if somebody in the family has it, you're more likely, not a guarantee, but you are at a higher risk to get it. It can be severe if it starts when you're a child or a very young age. And so signs and symptoms, when you look, you'll see this excessive overdevelopment even of the basal layer of the skin. And the affected areas look dry and cracked and crusty. And there's the buildup of this skin that's not just living, but it's living in dead tissue together. So it's just very icky. That's not a medical word. And again, to continue signs and symptoms, pruritus, it itches. It itches and itches and itches and itches. Common sites, you'll see it on the scalp, on the knees, elbows, sometimes on the inner fold of the elbow too, the umbilicus and genitalia. And then how do we treat it? Well, it depends. We can't cure it, right? Because we don't really understand why some people get it. But there are different things we can do to palliate it. In other words, like relieve the symptoms. Coal tar is a holistic remedy. You can find that over the counter. Vitamin D. Corticosteroids topically will relieve the inflammation because that's what they do. They decrease inflammation. And sometimes wet dressings, something like a hydrocolloid, which, because it's so dry, we can provide some moisture. UV light actually works to stop cell production with psoriasis. So a light lamp, right? A tanning bed. I didn't say that. So the exposure amount, like how long you need it, depends on what color is your skin, how much pigmentation do you have? Are you fair skinned or darker skinned? What is your susceptibility to burning, right? Natural sunlight works, right? And you want to be under the light to the point where it just starts to get a little red. So to the point of minimal erythema, gets a little red. If they really have it bad, we can use an artificial source like a mercury lamp, and even more aggressive treatment would be an excimer laser, which is kind of a controlled UV light that eliminates the plaque and controls the scaling and the inflammation. And then we have acne vulgaris. I always like that word too. It's vulgar. No, that's not it. So acne vulgaris is acne, right? Common, very common thing. Teenagers will usually get a zit here and there. It's an inflammatory skin disease where the sebaceous glands, the oil glands and the hair follicles can kind of get filled with pus, blackheads or whiteheads. They can be papules, little swollen red things, or pustules, raised areas filled with pus. Right? That's a bad case there. Usually it's on the face, but it can be on the chest, the upper back, the shoulders. Puberty, it's all about the hormone changes, but people can develop it at any age. Genetics play a big role in almost everything, and this is no exception. But there are also other contributing factors. Stress. You have to learn to manage stress because stress will kill you. It causes a lot of things. External irritants, like using a different kind of soap, even a different kind of fabric softener, different kinds of cosmetics. They can actually cause it or even make it worse. An acne plug usually starts off as either a blackhead or a whitehead, an open comedo or a closed comedo. And the color in it is caused by the melanin, not by dirt. So in other words, if it's a blackhead, it doesn't mean that that's a dirty whitehead. It's melanin, so it's color, okay? And eventually, it's just going to get a little bigger and it'll rupture, and the contents of it spread to the dermis, the layer under the epidermis, and it kind of spreads. It gets inflamed, red, and those pustules or papules will start to spread. And the sad part too is if it's really bad and really chronic for a lengthy period of time, even if you don't necessarily, like they'll tell you, don't scratch it, because it can leave scars. It can leave some significant scars. Okay, treatment. Well, the number one thing is to reduce the bacteria count that's on that skin, and then also decrease the amount of oil gland activity, right? That helps to prevent inflammation. Antibacterial solutions, oral antibiotics, if it's really bad, sometimes both. Topical agents, there are tons of over-the-counter products like with benzoyl peroxide, and the skin should be kept as clean and dry and oil-free, I'll add that, as possible. And then we have scabies. So scabies is a skin disease that is really, it's a little tiny bug, right? It's the itch mite is what it's called. And that's transmitted by contact, by contact. Scabies is one of those things where if a nursing home resident gets them, it will spread like wildfire in no time. So infected bedding, clothing, also those kinds of things. It's really hard to control, kind of like lice. Signs and symptoms. Believe it or not, initially, when the parasite is like living under the skin and multiplying, no symptoms. But then this is the one thing that you see is when the parasite starts to burrow, you'll see these wavy, either brown or black lines. And they're actually trails of like little marching armies of these parasites that are going up the extremities. Then they get the itching and the rash. Sometimes the lesions look excoriated. They'll get in between their fingers, in the axillae, which are the armpits, at the waist, the wrists, the elbows, the nipples, the buttocks, and the genitalia. So they can really cause a lot of problem. In order to treat scabies, it's a real nightmare because you have to treat the patient with some kind of a topical scabicide. And it's usually applied in a layer head to toe and left on overnight. And it's usually not just one application, usually a couple. Sometimes they need an antipyretic or oral antihistamine to help with the itching, like a Benadryl, right? Diphenhydramine. And you also have to treat everything around them, like the bedding, et cetera. Okay. On to impetigo. They used to call this foot and mouth disease. It's very contagious. We see it a lot in daycare centers because little kids, they don't wash their hands. They touch everybody and everything. And it's a superficial skin infection that usually is marked by this blister that starts to get pustular and can rupture and gets crusty. So there are lots of words here that you might not have heard before. So like, pustular, vesicle, and a bulla. So a vesicle is a little tiny fluid-filled blister. A bulla is a very large fluid-filled blister. So it's just the size that differentiates for both blisters, like a sac filled with fluid. So with impetigo, the lesions usually start as macules, vesicles, and pustules. So they look like, it can look even like acne, usually like around the mouth, right? Around the mouth, the nose, the neck, sometimes the extremities. But when the lesion, the original one ruptures, this thick honey-colored liquid kind of oozes out and gets hard and forms this crust. It's really gross. And sometimes there's redness, erythema around it with ulcerations, and this can even cause scarring if it's not treated quickly. How do we treat it? Topical antibiotics, oral antibiotics, cleanse the sites at least 2 to 3 times a day, and don't contaminate other people, right? Good hygiene, don't spread it skin to skin. Okay, a couple other words. Debridement. Debridement means you're removing foreign material. It's usually referring to a wound. Doing a wound debridement, you can do a surgical debridement where you go in with a scalpel or some similar tool and scrape out dead or damaged tissue in a wound so the wound can heal, right? So that's what debridement is. And then this is a very common procedure. It's called Mohs surgery. And it's used for different types of skin cancer. What they do is they go in and remove the layers of cancer. And they do it in thin layers because they want to do, pathology or a microscopic exam of the excised tissue. And they're just going to keep on going down, down, down until they get to no cancer cells. Right? Typically, cancerous lesions of the skin are weird shapes, weird sizes, very irregular borders. Sometimes they have ridges on them. They're kind of distinct looking. We can do skin grafts if the skin cancer after the Mohs procedure leaves a crater, right? We can do skin grafts, and there are different types of skin grafts. An allograft means we're taking tissue from another person and giving it to you. An autograft is where we use your own skin and maybe take it from one place and put it on another. Synthetic is just like the name implies. It's artificially produced skin. And then a transplant, a xenograft is a transplant from something other than another human. Could be a pig, could be a cow, so porcine or bovine, etc. And let's see. When we talk about allergies, right? So there are tests that we do if we suspect allergies in a patient. And the most common test is the scratch test or the prick skin test. And what we do is we actually take whatever we think you might be allergic to in a teeny tiny amount on this little kind of like vial with kind of a sharp edge. And we scratch an area of your skin to allow some of that allergen to like get into the skin. And then we look for a response. We look for erythema, irritation, right? Just like this picture. Sometimes they'll do them on the inner aspect of the forearm. And basically when we see the redness or the erythema or irritation, we know that's something you're allergic to. Intradermal is when we take a needle at an angle that's about 10 to 15 degrees and we inject just into the layer of the skin, intradermal, that allergen, right? Little tiny amount, and wait and observe and look for a reaction, okay? That's how we can figure out what you're allergic to. We did already talk about biopsy. It's where we take a piece of tissue from somewhere in the body to send it to pathology to figure out, a diagnosis, what's wrong with you. And let's see. The rest of these are exercises, and that is the end of 5. So let me stop that share and stop that recording.